Hi everyone. The essential question is, how are muscles named? We're going to talk about the types of muscles that work together to accomplish a body movement. And next we're going to discuss how we name muscles according to their location, orientation, their shape, their size, and the action that they perform. By the end of this lecture, you should be able to answer this question using all of these vocabulary terms. So when we talk about the types of muscles, we're really talking about how multiple muscles work together as a group to accomplish a particular body movement. And there are four roles that muscles take on to accomplish any body movement. There's the prime mover, the antagonist, the synergist, and the fixator. So let's use flexing the arm as an example. When you flex your arm, you have the upper arm shown here, you have the lower arm, and you have to bring the lower arm closer to the upper arm, meaning you have to decrease the angle between the lower arm and the upper arm at the joint. In this case, the joint is the elbow, of course. So let's start with the prime mover. The prime mover is also called the agonist, and it's the muscle with the major responsibility for contracting to accomplish that body movement. So I want you to identify what is the prime mover out of all of these muscles shown here. What is the prime mover in flexing the arm? So the answer is the biceps brachii. When this muscle on the anterior side of your upper arm contracts, then it's going to pull the lower arm because it originates up here. It's hidden by the deltoid muscle, but the biceps brachii originates up here. It's attached to the humerus bone, and then it's inserted down here. On the other side, it's attached to the radius and ulnar bones of your lower arm. And so when this muscle shortens, then it pulls the lower bones closer to the upper arm bones. Next question. The antagonist is the muscle that opposes or reverses a prime mover if it contracts at the same time that the prime mover does. Um, so in other words, the antagonist muscle has to relax at the same time that the prime mover contracts, because if both the agonist and the antagonist contracted at the same time, they would cancel each other out. So out of all of these muscles here, which muscle would be the antagonist to the biceps? In other words, which muscle, if it contracted at the same time as the bicep, would actually cancel out the action of the bicep? By the way, that banging you hear in the background, that's my son playing with Legos. So the answer is the triceps brachii. That's the antagonist. If we changed the motion, if your arm was flexed and you had to extend the arm, then it would be the opposite. In that case, during arm extension, the triceps would be the agonist and the biceps brachii would be the antagonist. So as one shortens, the other one must relax in order to allow the agonist to do its job. Okay, now the synergist and the fixator, those are muscles that aid a prime mover in, accomplishing the body movement, and they also help prevent rotation, lateral or medial rotation, unless that's what you want, right? At the same time, they sometimes also act as fixators, where they can stabilize the origin of a prime mover. The origin means that's the place where the prime mover muscle is anchored to the bone lying underneath. So there are two muscles that serve both as synergists and fixators during arm flexion. So let's see if you can identify what those are. The answer is the brachialis and the brachioradialis. So the brachialis originates up here in the upper arm bone. You can see that its origin is disappearing under the deltoid muscle. And then it's inserted in the lower arm. And the brachioradialis, you can see it originates up here. You can see where it's disappearing under the tricep, or not disappearing, but where it's attached, at the side of the tricep. And then you can see that it then goes around the lateral and anterior sides of the lower arm. So these two muscles, the brachialis and brachioradialis, they help arm flexion when they contract, but they also stabilize the movement so that you're not rotating laterally or medially unless you intend to do that, in which case you would be utilizing other muscle groups that are not shown here. At the same time, they also stabilize the origin of the prime mover, the biceps brachii. They help to ensure that the movement is smooth. So next we're going to talk about the conventions we use to name skeletal muscles. And even though there are over 600 superficial skeletal muscles in the human body, superficial meaning... it's a big number, right? I know, 600 is a big number.
It's a really big number.
Yeah, it's a really big number. So there are over 600 superficial skeletal muscles, meaning muscles that are directly observable if you remove the skin from a cadaver. But you're only going to be asked to memorize about 50 of them, so that's not that bad, right? That's Conan the Barbarian. Look at how muscular he is. So the first convention we use to name some muscles are where are they located. Sometimes they're named according to which bones they cover. For example, the frontalis muscle covers the frontal bone, which is a cranial bone. The occipitalis muscle covers the occipital bone, and then pictured here you can see the temporalis muscle, which covers the temporal bone. In the facial region, there's the zygomatic bone, which is your cheekbone, and you have the zygomaticus muscle, which covers that. In the arm, you have the radialis muscle and the ulnaris muscle, which cover the radius and the ulna. They stretch across the radius and the ulna, which are your two lower arm bones. In your legs, you have the femoris muscle, which stretches across your femur, your thigh bone. You have your tibialis and fibularis muscles, which are muscles that stretch across the lower leg bones, the tibia and the fibula. And then you have your digitorum muscles, which are the muscles that you find on the phalanges, the fingers and the toes. You can also name muscles according to their origin and insertion points. So the origin is where the muscle originates, or where is it anchored. And then the insertion is the place where the muscle attaches on the other side in order to accomplish a body movement that causes two bones to move relative to each other. So the sternocleidomastoid muscle is a great example of that. And you can see this image is taken from the medical reference book, Gray's Anatomy. So here you have the clavicle. That's your collarbone. And then in front of that, in the front part of your chest, you have your sternum. So the sternum is that bone that basically your ribs attach to. And so you can see that here we have a double-headed muscle that originates at your clavicle and at your sternum. And it inserts into the mastoid process of your temporal bone. So this is the temporal bone, and there's a part of it that kind of juts out behind your ear. You could actually take your finger and you can feel where it juts out. That's called the mastoid process. So the sternocleidomastoid muscle originates at the sternum and clavicle, sternocleido, and it inserts at the mastoid process of your temporal bone. You can also name bones according to the number of origins that they have. So the biceps is a two-headed muscle. Bi means two. Sep comes from the same word as cephalic, so head. I'm recording. Okay, so let's try to be quiet. Shh. Okay, so here you can see there's the head of your humerus bone. And you can see that the biceps muscle has two heads that attach to this knob on your humerus bone. And the triceps muscle actually has three. So from here you can, it kind of looks like you can only see two, but there's three heads there. In your leg, you have the quadriceps muscle. So that one has 4 heads. Next, we can talk about, we can name muscles according to their orientation. So in other words, if you look at the direction of the muscle fibers, and you know that that skeletal muscle is striated, right? It's striped because of all of the fibers. So if you look at the direction of the muscle fibers, in which direction are they going? If they run up and down vertically, then we use the word rectus for some of them. If they run horizontally, then we use the word transversus, transverse, meaning across, right? And if they run diagonally, then we use the term oblique. So here, you can see that there are other terms that we can use to describe muscles according to their shape. So once again, we can talk about muscles according to their orientation, but there are several muscles that do not have an easily described shape in that way. So one example of additional shapes for muscles would be circular muscles. For example, you have the orbicularis oris, orbicular meaning circular, and oris meaning mouth. You also have the orbicularis oculis muscles, which are found around the eyes. Another example would be convergent muscles, where the muscle fibers converge to one point at the origin or insertion point. And so an example of that would be the pectoralis major muscle, right there. Another shape would be parallel muscles. So an example of that would be the sartorius muscle, where the muscle fibers all run parallel to each other. So this is not an oblique because it's not a sheet muscle. It is a thin muscle, parallel muscle that accomplishes a specific purpose. And then you have unipennate, bipennate, and multipennate muscles. So these are muscles that are named not for their origins, but for their insertion points. And how many of those points do you see? So you guys should be able to see why they would be named unipennate, bipennate, multipennate. And then you have fusiform muscles right there. By the way, let's talk about the bipennate muscle here. So you can see that the rectus femoris is a bipennate muscle. But you should also be able to figure out why it's called the rectus femoris. So it is found stretching across the femur, and that goes back to our previous point about how the location of the muscle is also used as part of its name. Okay. Next, we can talk about muscles according to their orientation on the body. So if you look at the body in anatomical position, then lateralis muscles can be found on the side. Muscles that are on the medial or middle region are called medialis muscles. Muscles on the back are sometimes called dorsi, for dorsal. Then you have internal and external. External meaning they'd be more superficial, internal meaning they'd be deeper. And then you'd have muscles that are named according to which body cavity region they cover. Like, for example, abdominis muscles are found over the abdominal cavity. We can also name muscles according to their shape. So if you know your Greek, delta means, it's the triangle. Trapezius, rhomboid, right? So an example of that would be the deltoid muscle, which is found on the upper arm. It's shaped in a triangular fashion. We can also name muscles according to their regular size. So you have the gluteus maximus and the gluteus medius, for example. We also use the word major and magnus for large. We use the word brevis for short. We use the word longus for long. A great example of that would be the fibularis longus, which is not on here. So you'll get to it in the next lecture slides for MU2C. Okay. Last of all, we can name muscles according to their action. So muscles that cause flexion are flexor muscles. Muscles that cause extension are extensor muscles. If they abduct or adduct, then they're called adductors and abductors. And if they help you to stand upright, then they'd be called erector muscles. An example of that, probably the only example that I can think of off the top of my head, are the erector spinae muscles. So those are the muscles that run along the sides of your spinal column. And when those muscles contract, they help you to sit straight, right? They help your back to sit erect. When they relax, then you hunch over. So let's practice. Based on the name alone, I want you to imagine in your head where you would find this muscle. So the flexor carpi. That's my son using his Legos to fight with each other. Okay, so the flexor carpi. Carpi would be named for the carpal bones, which are found in the wrist, and flexor, they cause your carpal muscles to flex. And so there they are, the flexor carpi. So these are found in the lower arm on the anterior side, and when they contract, they cause flexion right there at the wrist. Next, the extensor carpi. Where would you expect to find those? And they would be on the posterior side of your lower arm. So the flexor carpi would be on the anterior side, the flexor extensor carpi would be on the posterior side. The occipitalis muscle. So the occipitalis muscle would be found over the occipital bone on the back of the head, and of course the occipital bone covers the occipital lobe of your brain. The tibialis anterior muscle. So if you know your bones, then you may know that the tibia is the lower leg bone, the main lower leg bone, and it would be, this muscle would stretch over the anterior side of the tibia, right there. Okay, where would you find the triceps brachii? So tri means 3, sep means head, brachii or brachius means arm. The triceps brachii is a 3-headed muscle. You can see the heads up here. So a 3-headed muscle on the posterior side of your arm. The biceps femoris. Bi means 2, sep means head, and femoris means femur. The femur is the thigh bone. So the biceps femoris is a 2-headed muscle, or its origin is double-headed, and it's found on the back of your thigh. Rectus abdominis muscle. So rectus, remember, stands for vertical or erect, and so these muscles run vertically all the way down your abdominal cavity. I do want you to notice, by the way, that the rectus abdominis muscles are deeper under the, you can see that there's this sheet of connective tissue that actually covers them, that's being cut away to show you all of the muscles of the abdominal wall. And so that sheet is called an aponeurosis. And it's the reason why like a six-pack is so hard to achieve, because you do have a sheet that's covering it, and then of course you have skin and fat that's covering that. Okay, next, latissimus dorsi. So lat meaning across, latissimus, that indicates that it's of greater size, right? Like maximus, latissimus, and then dorsi meaning back. So the latissimus dorsi stretches laterally. It's that big, great muscle that stretches laterally across your back. Erector spinae. So the erector spinae is this group of muscles over here that runs parallel to the spinal column, and so spinae, right? And then erector, meaning that when they contract, they hold you erect. And that's it. That's the end of my lecture. So you guys need to go back to the beginning and see if you can answer the essential question using all of the vocabulary here.